Hello, and welcome everyone to Talk to Tony Wilson. If you've watched my other videos, you've noticed that my topics surround the effects of COVID-19. My guest today, she's a little bit different in her story, that she is a woman business owner and has some effects from COVID-19. My guest today is Sonja Smith of Maryville, Indiana. She is the owner and administrator of a Family That Cares Personal Care, which is a home care agency that offers non-medical in-home care services for loved ones. Thank you, Sonja, for coming in and talking with me today. How are you doing?
You're welcome. I'm good, and you, Miss Tony?
I'm doing great today. I'm so glad to have you on my show.
Thank you, and I'm glad to be here.
Thank you again. Well, Tanya, tell us a little bit about yourself. What is your background with the healthcare and when you got started in the healthcare?
I got started with healthcare it was some years ago. It all started with my mom. She was a RN and she retired as a RN.
Okay.
And it kind of got started with that, but I took it a little different route as, getting into like the administrative part.
Okay.
But I have a daughter that's a LPN and she's now in school for RN.
Okay.
She has maybe like a few more months, a year to go, and then she'll be done. And then I have other family members as well.
Mm-hmm.
They're also in the healthcare field. So it kind of like it runs through the family like really tough, really tough.
Yeah, that's what it sounds like, but that's fantastic.
Thank
So
you.
what type of positions have you held, of course, before your agency? What type of positions had you done?
Well, I started off as a medical assistant.
Mm-hmm.
Maybe like 12, 13 years ago, I was a medical assistant. And at the time, I was going to school to be a medical assistant, and I ended up doing my internship at my doctor's office.
Oh.
And he liked my work so much, from the internship that he hired me on,
Mm-hmm.
and he wanted me to be up over the rest of the medical assistants as well. So like the medical assistant manager,
Okay.
I was that he made me. And from there, I just started, I just love healthcare and I love helping people.
Mm-hmm.
And so after that, the job had like relocated to where I didn't have any transportation to, get that far.
Okay.
So I ended up going into working with the mentally challenged
Mm-hmm.
individuals as a data specialist.
Okay.
And with that, I did that for like 18 years. And
Wow.
I love that too. I just love helping people.
Mm-hmm. Mm-hmm.
And from there, I started school with University of Phoenix.
Mm-hmm.
And I got my associates in healthcare administration.
Mm-hmm.
And just last year, 2019, I received my bachelor's in healthcare administration. And now I'm right back in there going for my master's.
All right. Good. Good for you. Well,
Thank
it
you.
sounds like you had a lot going on. Sound like things were going good for you. So
Yeah.
where along the line did you stop and say, no, I need to do my own thing? What was going on when you made that decision that you wanted to just do your own business?
Believe it or not, it started like from the previous jobs I learned. And with me, I feed off of other people and their actions and the way that they act and treat people and
Mm-hmm.
all of that. I feed off of stuff like that. And when I feed off of stuff like that, especially if it's not like if it's bad,
Mm-hmm.
I I want to make the good of it.
Okay.
So that's what made me want to like do my own thing.
Okay.
And I wanted to like treat people the way that they should be treated.
Mm.
And I'm speaking about the employees.
Okay.
That's what I'm talking about.
Okay. All right. So how long has your agency been in existence?
Uh, I want to say about a couple of years. I
Okay.
started off with the private pay clients,
Uh-huh.
and with that, we provide like assistance with bathing, meal preparation, light house cleaning.
Mm-hmm.
Um, so it was a lot of it, and it still is many more clients out here that's looking for services like that.
Mm-hmm.
And so that's the kind of services that I provide for my clients.
Okay.
And so with that, I worked my way on into applying for my license, and now I'm working on the Medicaid waiver program as well right now.
Mm-hmm. Mm-hmm. So along the way, I know when you're working with even private pay or health insurances, Medicare, Medicaid, it's not an easy task. Was it rough trying to get started and maintaining everything? Was there some
Yeah.
times in there where you said, I just want to give up? This is just too
Yeah.
much.
Yes, so many sleepless nights and
Mm-hmm.
crying, and it's stressful.
Wow.
But it took a lot of hard work and dedication, and I knew that this is what I wanted to do.
Mm-hmm.
So I kept going. I just kept going, and with the help of my daughters and my family,
Mm-hmm.
me telling me, "Hey, you got this.
Mm-hmm.
Um, keep going." So I kept going. I just kept going, and now I'm at the last step with just waiting on the approval from the Medicaid program.
Okay. Okay.
Mhm.
And I know if those doors, when those doors open up, there's going to be a whole lot more clients out there for you.
Yes, ma'am.
Yeah.
Yes, ma'am.
Yeah. Yeah.
Mhm.
Okay.
I can't
So
wait.
you do hire other employees. How do you go about looking for employees, and how do they come in and get their training or orientation for your company?
Well, we go off of I don't know if you ever heard of Indeed,
Yes, I have.
but it's a website that the job description is posted up, and we get many that apply, and they respond back with like their resumes.
Mm-hmm.
And so I don't do any of like the interviewing or anything. It's the other two girls in the office,
Okay.
but they go from that, and they go through two interviews,
Okay.
and after the interview we go through like a training,
Mm-hmm.
the all day training, maybe from like 8 to 12, I want to say 8 to 3,
Uh-huh.
depending on if they need like extra things, and we'll take it all the way into 3. But we take them through a training, and we also go out with the girls maybe like for the first few days,
Mm-hmm.
just it's called like a competency,
Okay.
just to see if the girls are doing, what they're supposed to be doing.
Mm-hmm. Okay. Well, since COVID-19 is part of our routine, what differently is your agency doing as far as the training and keeping your clients and your employees safe?
Oh, we're taking like so many precautions.
Mm-hmm.
um, First of all, beginning with the office, when individuals come into the office, the employees come into the office, we have them to take their temperatures,
Mm-hmm.
write it down, and if we also ask if they have been around anyone within 12 to 14 hours with COVID, we ask questions like that, and we have consent forms for them to fill out.
Mm-hmm.
And when the workers go into the home, they are asked, we provide like the forehead thermometers,
Mm-hmm.
and we provide those in each home, as many as we can. And the workers go in and they take their temperatures, they write it down, document it,
Mm-hmm.
and we also have them to take the client's temperatures as well
Okay.
and document it.
Okay.
When they go in, we provide PPE, personal protective equipment,
Mm-hmm.
and if it's ever a case that we have a COVID client, we make sure that the worker knows, and she's going in there with the PPE on, the gown, the mask, the gloves, eye gear if needed, only if that client has COVID.
Mm-hmm.
If that client does not have COVID, then we still do the temperatures, and they are to go in with masks
Okay.
as well,
Mm-hmm.
and change gloves on the regular.
Okay. Okay. Well, since I'll say February this year, and when we first started hearing about the COVID cases, there was a lot of agencies, even hospitals, that were concerned with not having enough personal protective equipment. Has your agency had any scares like that, or any fears of not having enough personal protective equipment to go around?
As of now, no,
No.
thank God. What I try to do, I try to stock up every week
Mm-hmm.
with masks and gloves, gowns. I stock up every week just so I don't run out.
Mm-hmm.
I even have sanitizing wipes and hand sanitizers that I provide for the workers.
Mm-hmm.
Uh, I stock up every week
Well,
as much as I can.
that's great. I know me and Sonia have had plenty of offline conversations, and you shared with me that your plan is to grow your company, maybe into other towns, other cities, other states.
Yes.
Um, what do you tell potential clients about COVID-19 and your employees that may be going in and out of their house? What do you share with them to let them be a little bit more comfortable with that?
Um, I just frequent hand washing, just to be careful, to keep up with the temperatures.
Mhm.
I just tell them to be very careful.
Okay.
We have trainings on it
Mm-hmm.
that we call in services,
Mm-hmm.
that we call it.
Mm-hmm.
And we speak about it. And if any questions or any concerns, bring it to the table.
Right.
We're there for them all the time.
Okay.
But we try to make them feel as comfortable as we can. Um, I've had a couple of employees that they quit
Mm-hmm.
because of the COVID, and they
Uh-huh.
didn't want to like take any chances because they
Mm-hmm.
had kids at home, and I truly understand that. And if they were to ever want to come back and work for me, I would hire them
Mm-hmm.
because they're very good workers. But they were more concerned of their kids than themselves.
Oh, okay.
Yeah, so we just try to, take as many precautions as we can,
Yeah. Okay.
and speak to them about the precautions.
Mm-hmm.
Everything should be okay. Freaking frequent hand washing
Yeah.
is one that I forgot to mention,
Mm-hmm.
but that's so very important
Oh yeah.
also.
Oh yeah. That's like our number one thing to help prevent the spread of germs,
Yes,
infections.
yes.
Yes. Okay. Well, is there any other information that you would like to share with us about home care agencies and COVID? What type of questions do family members or clients, what type of questions should we be asking home agencies if we're interested in getting your services?
What type of questions should you ask me?
Uh-huh.
Um, um,
Just
anything that you would like to ask?
what we should be asking,
Oh,
the agency about COVID-19 and how y'all going to protect us. Is there any particular thing that you think we should ask agencies if we're looking to get your business?
I get that a lot. When we have clients that's calling in and they want services, I
Mhm.
get that a lot.
Okay.
They want to know what are we doing to protect them
Mm-hmm.
as well as the workers,
Right.
um, from the COVID, and I explain to them the same.
Mm-hmm.
Um, COVID testing is done. We have COVID testing results on file.
Mm-hmm.
from the workers before they're even hired.
Okay.
I ask that they have a COVID testing done
Mm-hmm.
and bring the results in, and I file it. So this is what I tell the clients when they call and they want services, that um, the workers are screened,
Mm-hmm.
COVID, and the protective gear
Okay.
that they wear,
Okay.
hand washing, same thing.
Mm-hmm. Okay. Well, that's good.
Just,
That's something.
just,
Yeah. That's
yeah, just try to make them comfortable as we can, as
yeah.
much as we can,
Yeah.
especially when they call and they want services. I just
Uh,
want them to be secure about that.
right.
And 9 times out of 10, they are
Mm-hmm.
okay with, the response that I give them.
Okay. And now, does the client wear mask also, or do you suggest that, or the client to wear the mask
Yes,
also?
yes, I do. I do suggest it, but if that client is maybe like on oxygen,
Mm.
um, I excuse that.
Okay.
But the workers are my main concern when they're going into the home.
Mm-hmm.
The clients are my concern also, but protecting those clients
Mm-hmm.
from that virus is to have my workers be protected as well with the
Right.
gear, the protective gear,
Right.
to protect them
Right.
from getting the virus or any symptoms.
Exactly. Exactly. Well, look, I give you guys a giant thumbs up to home health, home care, for continuing on through this pandemic, going in there to take care of our loved one in the homes. Y'all
Thank you
are
so
some
much.
great heroes. Yes, you are. And I
Thank you.
just love your inspiration. I love your motivation, your drive to continue and
Yeah.
grow your business. I really, really love that in you.
Thank you, Tony, so much.
Uh-huh.
So thank you.
Is there any?
Yes, I love working with people, and what I'm doing right now, I love it. I love it to the heart. I swear I do.
All
And
right.
I want my clients to be secure and protected as much as we can possibly do for them.
Right. Well, that's
Yes,
fantastic. Well, y'all, look out for a family that cares, personal care. It may be coming to your neighborhood soon. Again, Sonia, I just want to thank you for coming on to the show and just talking to us about being a female business owner and dealing with COVID-19. Okay.
thank you
Like I
so
said,
much.
again, I just thank you so much.
You are
Okay.
so welcome.
So this concludes another talk to Tony Wilson. And to all I will say, have a great day.
Thank you. You too, Tony. Have
Thank
a
you.
great day.
Mhm.